Plug and Play Abu Dhabi, we connect global startups with world-leading corporations and government entities to drive innovation.
I'm Christine Ashcroft. I'm a molecular biologist by training. I also have an MBA in entrepreneurship, and I have been in the precision medicine space, specifically pharmacogenomics, for just over 20 years now. My particular startup that's now under the Invitae umbrella, YouScript, is a clinical decision support tool that integrates into electronic health records, pharmacy software systems, flags patients at risk of having adverse drug events, and then provides real-time drug and dose optimization guidance based on their genetics, as well as anything else that impacts drug response. Way back in 2000, there was an article in Fortune magazine about this little boy named Michael who had died of an overdose. He had an easily testable genetic variation that, in concert with his other medications, led to toxic buildup of this medication in his system. And read the story and went to the underlying literature to look at just how common these genetic interactions were, how often they occurred, and became one of the first labs in the country to provide that testing. And I had a pretty unique opportunity to speak with literally thousands of patients, providers, payers about widespread barriers to adoption of technology that likely could have saved Michael's life. And there was a very common thread to the questions. How do I know which patients to test? Who's at risk? How do I know how to act on that in the context of other things that impact drug response? So really focused my career in developing these software tools that could answer those questions right in the clinical workflow in the EHR. I hope to gain out of this program the future of health by plug and play, really wanting to plug into the Middle East market, ideally by finding a collaborator that would like to work hand in hand with us to localize our clinical decision support tool and bring the benefits of this award-winning software to the region. Anytime a patient has to take a lot of medications, this genetic information becomes even more important. Our studies in the United States have shown dramatic reductions in emergency room visits, hospitalizations, readmissions, even death, and saved quite a bit of money. And so we would like to validate similar outcomes in this region and really find a good partner that can help us navigate the local needs there. So being an entrepreneur, especially for female entrepreneurs, I'd say, don't be afraid to seek out and ask for help and find mentors. The one other thing I would say, I did work with a nonprofit, Springboard, that helps women-led companies raise venture capital. That was also very helpful. A lot of women that are helping other women. Because there are some additional navigational hurdles sometimes, and so it's helpful to work with people that have navigated that before. It is so valuable to get candid advice and feedback on how to do business in other areas, what you need to refine in your strategy in different regions. And so have been incredibly impressed with the caliber of people that I have had the opportunity to speak with as part of this program. So very encouraged with the dedication from so many people.